Hi, I'm Ayla Achad. I'm a registered nurse and the Vice President of the West Virginia Nurses Association. I'm also the chairperson for this year's Nurses Day at the Legislature. We have posters all over the Capitol that you can go and see and learn more about the professional practice of nursing and what that involves. You know, healthcare is changing, and as technology and physicians focus more on specialized care, nurses are called upon to provide the high-quality, health-oriented care that's always been the focus of our professional practice. Nurses deliver this care close to where West Virginians live, learn, and work. The public named nurses the #1 most trusted professional 12 years running. We take that charge very seriously, and that's why we're proposing to you 4 pieces of legislation this year that address the need to increase quality nursing care availability in West Virginia. These proposals are recommended and supported by the Institute of Medicine report on the future of nursing, the National Consensus definition for APRN, which was arrived at by 40 specialty organizations across the country over a 4-year period, National Council of State Boards of Nursing, their guidelines, and national evidence-based research that validates the excellent outcomes achieved by nursing interventions, particularly in the high impact areas of primary care, long-term care, chronic care management. Please listen now as 6 West Virginia nurses share with you real case examples of how these 4 pieces of legislation will affect your constituents. The first line of health care for students in West Virginia is often the school nurse. Certified school nurse Belle Haddad is going to share a situation with you now that's kind of scary. It's something you wouldn't want your child or grandchild to have to face. The school nurse ratio bill addresses this concern.
I have been a school nurse in West Virginia for 15 years, and during that 15 years I have seen a dramatic increase in the number of students with severe acute healthcare problems. We are seeing in West Virginia an increasing number of students with recently diagnosed diabetes, asthma, serious life-threatening allergies, and mental health problems. And for every one of those problems, a health care plan needs to be written, an emergency care plan needs to be developed, and intensive staff training needs to happen in order to assure that that student stays safe while they are at school. I have always had multiple schools in my assignment. This year I have 3 elementary schools with just under 1,000 students. Let me tell you about a true situation, a true story that happened in one of my schools several years ago. I had a little boy who was diagnosed with type 1 diabetes, and he had recently been experiencing frequent sudden drops in his blood sugar. When that happens, when a blood sugar drops quickly, the person can go into a state of unconsciousness, have a seizure, and ultimately die if treatment is not administered immediately. I had trained the staff in my school to look for signs of low blood sugar or hypoglycemia, and I had trained them as to what to do if they saw those signs, including administering an emergency injection of glucagon. On this particular morning, the mother had given the little boy his morning dose of insulin at home, put him on the school bus, and during the school bus ride, his blood sugar began to drop very, very quickly. He got to school, got off the bus, he walked into the cafeteria. He was no sooner in the door when he dropped down, became unconscious, and began having seizures. The staff who had been trained to treat this episode, to deal with this episode, due to a series of situations, were not nearby. The staff who were nearby called me on my work cell phone. I was in my car driving to another school on another side of the county, if you will. I answered my phone, and proceeded to tell them immediately, call 911 and administer the emergency injection of glucagon. But unfortunately, the staff who were trained to do this procedure were not in the immediate vicinity. When I hung up my phone, I happened to think to call a school nurse who lived close by in hopes that she would be somewhere near the school. Luckily, she was running a little bit late that morning. She was near the school, and she proceeded directly to the school. When she got to the school, she got there right behind the paramedics, and when she walked in, she said to the paramedics, "Has anyone administered the emergency injection of glucagon?" The paramedic looked at her with a puzzled expression and said, "No one told us that this child was a diabetic. We didn't know that we were dealing with a hypoglycemic episode." If things had happened differently, if I hadn't answered my cell phone because I was driving, if the school nurse had not been close to the school, very well this child could have not been accurately diagnosed, and his low blood sugar would not have been appropriately treated. A certified school nurse is the most accessible, cost-efficient method of delivering quality health care to our West Virginia students and their families. Funding for a certified school nurse for every 750 students is at least a beginning to assure that our students stay safe and healthy while they are at school. Thank you.
The APRN bill removes the barriers to providing the full scope of nursing care that nurses are educated, certified, and licensed to provide. Physicians are being cautioned about taking on the legal liability of entering written collaborative agreements with nurses. And frankly, we don't know why they should have to do that. Nurses already have adequate oversight through education, certification, and licensing, and the professional ethical standards of our practice requires us to collaborate. Collaboration is professional nursing standard and does not require the additional burden of a barrier of a contract. Listen now as 3 APRNs share with you real situations where removing this barrier will serve your constituents better.
Hi, my name is Tammy Cunningham. I'm a certified registered nurse anesthetist. I'm an advanced practice nurse. I'm here to talk to you about the advanced practice nurse anti-competitive bill. Certified registered nurse anesthetists, also known as CRNAs, work in collaboration with surgeons, anesthesiologists, podiatrists, dentists all over the state in providing West Virginia citizens with high-quality health care. When a woman in Huntington's in labor, a West Virginia CRNA is there to provide pain relief. When a 6th grade boy's appendix ruptures in Beckley, a West Virginia CRNA is there for his emergency surgery. When a college student suffers a brain injury during a car wreck in Charleston, a West Virginia CRNA is there to provide anesthesia care. When an 80-year-old Lewisburg man fractures his hip, a CRNA is there to provide anesthesia. When a 50-year-old woman in Gassaway needs a suspicious lump removed from her breast, a CRNA is there to provide anesthesia. When a 60-year-old man in Morgantown has a prostatectomy, a CRNA is there to provide anesthesia care. Certified registered nurse anesthetists are the only anesthesia providers in many of West Virginia's rural hospitals. These hospitals are the lifelines for their rural communities and provide access to care close to home for the citizens of these counties. Since these hospitals rely heavily on the income generated through these surgical procedures, it is no exaggeration to say that certified registered nurse anesthetists help keep these hospitals in business. All these CRNAs want you to know they are proud of the work they do and are proud to call West Virginia home. And West Virginia can be proud of their 410 certified registered nurse anesthetists who are advanced practice nurses.
Hi, my name is Rebecca White. I'm a certified nurse midwife who came here to West Virginia to work through the National Health Service Corps, which is an organization dedicated to providing healthcare providers to underserved populations. and I wanted to touch base with you today about why we want to welcome Certified Nurse Midwives, or CNMs, into the definition of advanced practice registered nurses. It's one of the most effective ways of providing quality, cost-effective care throughout all communities in West Virginia. And with this new legislation, CNMs, myself included, will be able to provide access to care that is within the full scope of our practice. So rural communities are often the place where CNMs are found. And Kayla was lucky enough to have a CNM for her birth and her pregnancy. She lives in Roane County, and the hospital in that county shut their labor floor down. And this is not an uncommon finding for many hospitals in West Virginia. According to the Perinatal Partnership, over the past 35 years, over half of the hospitals in the state have closed their doors to maternity care. And in Kayla's community, it's a CNM that's able to continue to allow her to receive prenatal care in her local community. Kayla was able to find transportation just a few miles, 10 to 20 miles, to her local office, receive prenatal care, including preventative measures, flu vaccines, dental cleanings, and then was able to, when an abnormal finding was found on an ultrasound, her CNM was able to consult with a local specialist in the urban area. Kayla didn't have to leave her community. She only had to travel the 100 miles to the local urban area once for the birth of her healthy full-term baby. And when she returned home to Roane County, she was seen by that certified nurse midwife again for postpartum checkups to make sure everything was going all right. It was the CNM who kept those doors open for Kayla and her family. And if the current legislation does not change, this CNM will have to give up her own practice if her collaborating physician retires. As CNMs adopt the same definition of practice as APRNs in West Virginia, they'll join 21 other states, many of them with rural counties like West Virginia, in allowing us to practice as independent providers in the full scope of their practice. The ACNM, the American College of Nurse Midwives, is our professional organization, and they state that there's no evidence that this change to independent practice would result in a change in safety or quality care to our patients. In addition, this model is what is envisioned and outlined by two professional organizations, the Professional Organization for Certified Nurse Midwives nationally and the National Professional Organization for OBGYN Physicians. They created a joint statement, so they both wanted everyone to know that their ideal collaboration would be this: that OBGYNs and CNMs are experts in their respective fields of practice. They are educated, trained, and licensed independent providers who may collaborate with each other based on the needs of their patients. That's what they say. And this collaboration is a standard in the practice of all advanced practice nurses and all certified nurse midwives. That will never change. Having those relationships dictated by legislation restricts access to the full range of services that CNMs provide. Think of Kayla. With this legislation, doors will remain open for her to receive care that she needs and deserves.
Hi, my name is Michelle Solanic, and I'm an advanced practice registered nurse. I've been a board-certified family nurse practitioner in the state of West Virginia for the past 20 years. I work at West Virginia Health Right, the state's largest free clinic, as well as Family Care, which is a federally qualified health care center. I serve our state's most vulnerable citizens, and I provide a broad range of primary care services in both of these clinics. I've been quite fortunate over the years to have established many excellent collaborative relationships with my physician colleagues. I find it rather disturbing to learn that we're losing hundreds of talented advanced practice nurses to other states because they've been unable to attain written collaborative agreements with physicians here in this state, and so should you. The Advanced Practice RN Removal of Anti-Competitive Barriers Bill is being presented to you as an opportunity for you to lean forward. And I ask you to endorse a Nurse Practice Act that reflects current nursing practice.
In order to have enough quality nurses, we need enough quality faculty to teach them. The Faculty Tax Credit Bill addresses this need. Listen while Wesley Massey explains to you how that has affected him as a faculty member.
Hello, my name is Wes Massey, and I want to talk to you about the Nurse Faculty Tax Credit. This tax credit can benefit individuals like myself who are full-time nursing faculty in the state of West Virginia. I've been an RN for 3 years and recently started working as a full-time faculty member at my alma mater. While at my alma mater, I had the privilege of learning from professors that taught me to be who I am, taught me how to care for patients and to develop the passion and the knowledge to do that. And when I came back, it saddened me to see that many of these same professors that I once learned from have now gone back to the hospital because they had bills to pay. They had to pay for their undergraduate and their graduate schools. And it's sad to know that they'll no longer impact the minds of individuals like they did for myself, all because they have bills to pay. It is also a requirement from the Board of Nursing that nursing faculty have advanced degrees at the graduate level, whether it's a master's degree or a doctorate degree. Many of the faculty that I work with, including myself, have either gone to in-state universities for these degrees or continue to go to in-state universities for these degrees, in which we are paying out of pocket for these expenses at our in-state universities. So we're putting funds into the state and we're asking for a little help back for what we're giving. The national standard for licensure examination for student nurses was at 88.4% in this past year. West Virginia standard was at 85%. So as you can see, we're below standard. In the past 10 years, we've only been above the standard twice, only twice. In 2008, we finished dead last. We finished 50th out of all the states, including Puerto Rico and the Virgin Islands. Part of this is due to a combination of a shortage in nursing faculty, the reduction of pay of nursing faculty, and also admission requirements for nursing students. So this is indisputably one of the best ways that we can keep nursing faculty where they belong, which is in the higher learning institutions in the state of West Virginia. And that is to pass this tax credit so that it is an incentive to stay in the positions in which we love and desire and want to be in.
We are proposing a nurse health program bill that assures safe care for the public while providing the same opportunity for peer intervention and confidential care that West Virginia's physicians and pharmacists already have. Renee Green shares why this is so important.
Hello, my name is Renee. By having a program like this, the nurse would feel more confident, would come forward more quickly. Thereby, it would be safer for the public, because if she has nowhere to turn, then she continues to isolate. She continues to, if it's depression or mental illness, or substance abuse, whatever, she seeks another measure for relief. And from my working with physicians in recovery, and I have also noticed this with nurses, they're usually the best, the brightest. They're the ones who want to do the most for their patients. They give all they have to everyone. Consequently, they have nothing left for themselves. So I really want the nurses in West Virginia to have the same opportunity that the physicians and the pharmacists have, and have the legislation to allow for the program to exist.
The West Virginia Nurses Association respectfully requests that you take a careful look at and support these 4 pieces of legislation that we're submitting to you this session: providing a nurse faculty tax credit, improving the school nurse ratio, removing the barriers to the full scope of APRN practice, and establishing a nurse health program. Examine these bills like your life and the life of your family members depend on it, because it very well may.